Is teen vaping really an epidemic?
Well, it depends on how you define an epidemic, which is actually not, as far as I can tell, doesn't have strict guidelines in terms of definitions. But it has been declared an epidemic by no less than the Food and Drug Administration and the Surgeon General of the United States. So, by their account, it is an epidemic. I think what they're reacting to is data information that came out late last year about vaping rates here in the U.S. among youth, kids in middle school and high school. And there was definitely an uptick in vaping, which they interpreted to mean that there is an epidemic.
So when the largest public health agency in the world, possibly outside, I guess, of China, uses the term epidemic and clear and present danger, aren't these the terms that FDA and CDC would use for yellow fever and Ebola?
Yeah, and you bring up Ebola. It's raging in the Congo right now, and that's an epidemic. But the term has been intended to include not only diseases and disease categories, but pretty much any kind of behavior. So I think they're just taking advantage of the loose definition of epidemic.
So what are the most recent stats then for youth use in the U.S.?
Yeah, so this is the latest data that was released, 3 months ago by the CDC, and this comes from the National Youth Tobacco Survey, which is sponsored by the CDC, and it's conducted every year here in the United States. How the CDC typically breaks down this information, so they talk about the past 30-day use. So those two numbers are similar. Well, the blue bar for past 30-day use is similar to what we saw in the previous slide, and then you see the uptick from 2017 to 2018, so going from 7.9 to 13.5%, and that's the increase that has gotten people pretty concerned.
From a researcher's point of view, granted, fair enough. You've collected this data. This is great data. But the public is only hearing about this 7.9% jump to 13.5. They're never seeing this never use, these two bars, which are massive. And you go, oh, wow, never use? That's huge. Common sense starting to trickle in. And then when you see past 30-day use, and then infrequent use, and then frequent use being like so low. Well, boy, if the public saw that, then they would have a chance to then kind of evaluate this for themselves. But instead, FDA says it's epidemic. The researchers only push the 30-day. The media only gets the 30-day. And then the 30-day number that's the only part of this chart that makes it to the public. Whereas if this whole chart did, reasonable adults could then form their own opinion.
Right, and if you go to the next slide, this is the same data, just chopped up in a bit more detail. And, this is how the questions were asked, on the survey. And, this gives you a better kind of sense of, where the increases are occurring. And again, there's across the board, increases in use, but, the numbers, start to get low when you look at more frequent use. The thing that, you mentioned, this is not what the public gets to see. And frankly, this is what was annoying and frustrating by the, back in the fall when the FDA and CDC and the Surgeon General were saying it's an epidemic. We researchers didn't have access to even this information at that point in time. And, we're an obsessive compulsive bunch. We like to, slice and dice and dissect and look at everything and kick the tires for ourselves to convince ourselves that, we understand what's going on. And, I have to say, and, no offense to the FDA or the CDC, or the federal government, but, we don't take things, on trust. That's not how science works.